Good afternoon, everybody. Myself, Dr. Gurvinder Singh. I am consultant physician at GB Pant Hospital. Today's topic of discussion is basics of diabetes. So, diabetes is a chronic metabolic disorder characterized by persistent hyperglycemia. Diabetes is mainly divided into type 1, which is seen or diagnosed in young patients and is characterized by autoimmune destructions of beta cells of islet, leading to absolute insulin deficiency causing hyperglycemia. Secondly, the most common type of diabetes, which is type 2 diabetes, it is because of insulin resistance. Insulin is there in the body but is unable to perform its usual function in a normal way. Thirdly, gestational diabetes is seen in pregnant patients in second or third trimester who were non-diabetic prior to conception, and these gestational diabetic patients are at high risk of developing type 2 diabetes in later life. Now, the clinical symptomatology of diabetes is there would be increased urination, increased thirst, increased hunger, weight loss, vision loss, tingling or numbness sensation in feet and arms, decreased healing of any wound anywhere in the body, and increased frequency of infections and general tiredness for whole days. So how we diagnose? We diagnose it with blood sugar fasting or glucose tolerance test or HbA1c levels. So as per WHO criteria, is if fasting blood sugar is more than equal to 126 milligram per deciliter and HbA1c is more than 6.5, and on glucose tolerance test after 2 hours postprandial sugar is more than equal to 200, we label that patient as type 2 diabetic or type 1 diabetic, depending upon other clinical features persistent with the particular type of diabetes. Now, the treatment part in type 1 diabetes, as we have discussed, that there is absolute insulin deficiency, so the only treatment option is insulin therapy. We have various preparations, long as well as short acting of insulin, which we use in these type of patients, and generally patient have to be on insulin for lifelong time. Secondly, in type 2 diabetes, we have various wonderful drugs which are categorized as oral hypoglycemic drugs, and we have different insulin preparations also, which we also use in these type of patients. Whereas if we talk of gestational diabetes, mainly we use metformin or insulin therapy for that. Now, if we don't diagnose diabetes at the earliest, or we don't treat it in a proper way, it will lead to various complications, and diabetic complications are mainly divided into two types: microvascular as well as macrovascular. In microvascular, mainly we have nephropathy, retinopathy and neuropathy, and in macrovascular we have cardiovascular, cerebrovascular and peripheral arterial disease. So diabetes is a chronic disorder and it needs to be educated to mass population, and it should be diagnosed and treated appropriately. Hopefully you will find this video helpful, and it will add to your knowledge. Thank you very much for having me.